Hello again, everyone. My name is Mark Lucchese, also known as Mark at the Mic, and welcome back to another Mark Goes Rogue podcast. This podcast is not going to be about any Burlingame history, but instead it's an interview with my best friend Chuck and my thoughts about the day he called me and told me that he had stage 4 prostate cancer. Although several months have passed since he told me about his condition, we talk on the phone almost every week about his medical updates. Prostate cancer strikes 13 out of 100 men. Today I'm at Chuck's home for an interview about his journey with prostate cancer. Well, Chuck, thanks for taking the time today to talk about this disease.
Sure thing, Mark.
Hey, you know what, before we begin, I have lots of questions for you, but before we begin, I think it's important that we tell our listeners that we've known each other for over 50 years, going back to our Long Beach State days when we were college roommates.
Absolutely.
Yeah,
good times all around.
Great times. So, Chuck, let's just jump right in, okay? So when and how did you find out about your prostate condition?
Well, it all started around 2014. My GP, general practitioner, called me and said, hey, you got a prostate PSA number that's gone from 3.6 to 4.68. He says, I think I'd like to refer you to a urologist. So naturally, I got very concerned. So I said, well, okay. So I went to the urologist, and he did what's called a digital rectal exam. And for any of you that don't know what that is, it's inserting the index finger up into the anus to see the size of the prostate. So he did that, and he said, oh, well, I don't see any enlargement at all here. And my PSA at that time was 5.0. So he said, come back in 6 months and see me. And I thought, well, I think this is all a big crock, and I decided not to see him. And I just kind of let it go. And the reason for that is I have family members that had minimal prostate cancer. It was like a Gleason 6, which is considered extremely low aggressiveness in the cancer. And he went and he had radioactive seeds put in, and it ruined his urethra. It obliterated it, where he had to have surgery to rebuild his whole penis and his urethra. And I have an acquaintance as well who went under active surveillance, where the doctors will give him biopsies every so often and check and monitor. So he went through all that, and what happened with that was he had surgery, and the surgery was fine, but then it was considered a positive margin, which means that some of the prostate cancer was left in there. So then he had to have radiation, and he did that. And after that, he continued on with treatments, and now he's dead. And so after knowing all this and everything that I've read, which I've read a lot of books, a lot of journals, I thought perhaps I could kind of escape treatments and the side effects. So in 2016, because I wanted to avoid regular doctors, I went on my own to a lab and had a PSA test, and it jumped to 9.5. And I was absolutely horrified.
That was in 2018,
2016.
16. So 2 years later, it just went dramatically up.
I was absolutely horrified. So I thought, this is baloney. I mean, I can't believe this is really true. So I did some more reading, and I learned some things about diet, how that can slow the progression of prostate cancer, and eliminate the possibility of having treatments that are, horrible and have horrible side effects. So I went on all kinds of, I went completely vegan. I changed my diet to vegan, and I took lots of vitamin supplements and so forth. And I developed a hydrocele in my left testicle, which is it's like a water balloon. It's something that's full of fluid. It has nothing to do with prostate cancer, but it was something that I needed to deal with because it was huge. It was uncomfortable to walk and all that. So I made an appointment to go in, have that checked over, and they did a PSA test, and the PSA test was 28.3. So now I'm really horrified. And my urologist took care of the hydrocele. He drained it, And then we had to talk about, well, what I'm going to do next. So he did biopsy, and it was a 12 needle biopsy, which is standard. And I had been very resistant to having a biopsy because there's a lot of cases of blood infections and sepsis where men have been having to put in the hospital. Some have died just from a biopsy. But here I was with a 28 point, whatever I said, 28.6 PSA. So he did the biopsy and it came back. And again, I'm horrified because all the 12 cores, all of them, every single one showed prostate cancer. Most of them was a Gleason score of 7, which is considered intermediate. And then 4 of them were a Gleason 9, which is considered very high risk aggressive prostate cancer. So at that point, it's like, okay, I'm yours, you own me. What do you want to do with me now? Because now I'm extremely frightened. I read further on prostate cancer and what it can do and spread through the body, get into the bones, cause paralysis, complete paralysis. So I went and met with my oncologist, which is the cancer part of the whole thing. And he says, I want to check your lymph nodes too, because I'm concerned. We went through your scans. I had CT scans done. I had MRI done. He said, I'm concerned about your lymph nodes. So I had what's called a PSMA scan, and it's a relatively new technology where they scanned me, and it showed that I had cancer in the lymph nodes, in the pelvic lymph nodes, and also in what's called the retroperitoneal lymph nodes. So basically, it had metastasized. So now I'm a stage 4. It's considered a stage 4. So I went with the oncologist, and after all that information, I sat down with him. I said, so how long have I got here? And he says, well, we just don't know. But he talked about 2 types of stage 4, stage 4A and stage 4B. Stage 4A is primarily the lymph nodes and the rest of the prostate. And 4B is beyond the lymph nodes and into some of the other organs of the body. I said, what if I have 4B? What does that mean? He goes, well, you have 3 years or less to live. That's what he said. So I'm somewhere between 3 years or less to live and maybe 5 or 6 or 7 years, according to what they say. But then he said, you know what? Everybody's different. We can't nail it down 100%, but it's obviously not a good prognosis. So I'm scheduled now to have, I've been on meds. I'm on something called Zytiga, and I'm on Lupron shots every 6 months. And what that does is it takes away all the testosterone. All my testosterone is basically gone. And what that does, it starves the cancer cells. Because the cancer cells need testosterone to replicate and divide, and it starves it. So my PSA has gone from actually a high of 40 all the way down to less than 0.1, which is considered undetectable.
Yeah.
Now, it doesn't destroy the cancer, but it does contain it. And I'm scheduled for radiation, 28 treatments. It's like 6 weeks, 5 days a week, off on the weekends, with the intention of actually killing the cancer where they can see it via the scans that they've been done. So that's where I'm right now, and that's going to start in January. And I actually feel pretty good. I'm a little fatigued at times, and I think that's because I'm not sleeping real well. And my bladder doesn't work great because I'm up 8 times a night.
Yeah.
And that's miserable because you know how it is. If you don't get enough sleep, you're just feeling like kind of like a zombie. So
let's go back a little bit and talk about your initial reactions and how you told your wife about it and how she reacted and the kind of support that she's giving you at this point?
Okay. Well, when it first hit me, and I had the information from the doctors and everything of what was going on, I felt like I was in somebody else's nightmare. I felt like this can't be happening to me. This is like someone else's nightmare, and I really felt that way. And I talked to my brother too, who's had the prostate cancer. He says, "Yeah, that's how it feels. You kind of walk around like a zombie." And I told my wife the results of everything that happened, and she was like, all business. Everything was all business. You're gonna deal with this. Something you're gonna deal with it, and you're gonna take it into action, and you're gonna get down to the end of it. Because she had her own health issues that she had to deal with, and they were pretty serious. And she went through some of that same feeling of like, how can this be happening to me? So she's been a great support. It's kind of like whatever I need. She suggested some supportive supplementation and, diet and all that kind of thing. So I was sitting there thinking, why me? Why is this happening? And then the epiphany was, I thought, after thinking about all the people that I've known, my relatives and friends that have had horrible things happen with their health, I thought, well, why not me? Why not me? I've gone 74 years with perfect health, and I've seen people all around me develop horrible things happen to them health-wise. And like, okay, I guess it's my turn. It's my turn now, and so how am I to deal with it? And I said to myself, you know what? I'm going to deal with it like I know how to deal with stuff. Basically, have a good attitude, be happy, look at the bright side of things, glasses half full all the time, go out and enjoy a sunny day, use my boat, play my music, have some good friends. And I have to say, Mark, your friendship has been fantastic. Fabulous support. So I thank you for that.
Thank you. You bet.
So I'm actually right now in a very good place. I'm handling all the meds. I'm handling all the treatments, and life is good. Life is good.
Along the course of all your dealings with the doctors, you did go through a surgery, though, correct?
Yeah, the surgery was called a green light laser surgery. I was having a difficulty urinating because the prostate cancer had enlarged my prostate and caused my urethra to tighten up, which made it really difficult to urinate. So I went to my urologist and we talked about this, and he said, well, we can do it. He mentioned a number of things. He mentioned a thing called Urolift, which they shoot with a gun, these staples that pull the channel open in your prostate. And then he mentioned TURP, which is a transurethral resection, which has been around for a long time. And then green light laser, which is pretty new technology. What they do is they go in through the urethra with a camera and a laser, and it vaporizes the inside of the prostate and creates a big cavity. So the flow like really improves, and that makes a big difference. So the other purpose of that was so that if I swell up from the radiation, I don't end up getting complete urinary retention where I can't urinate at all, because that's dangerous. You end up in a hospital with that. So I went through the surgery, and basically I had a catheter in me for 3 days. There was really no pain. It was kind of like a in and out. Get there early in the morning, you're out late afternoon. And that part was okay. I still have pain when I urinate right now, and he says over time it'll get better. But here's the thing that's really kind of the kicker. Now, when I want to go to the bathroom, it used to be I could get up and I'd go, and I'd make it to the bathroom and I'd go. Well, now I get up, and halfway to the bathroom, I lose it. I lose control. And that's just the way it is. So I'm wearing incontinence pads now, as a matter of course. And I used to have a lot of anxiety when I go to the beach or go places because I was always worried about, wetting my jeans or whatever and having a big old spot. And so now I don't have that fear because I have the incontinence pads. So, the shame is gone. I don't have any shame about it. I go, well, screw it. I got to do this. I got to do this. It's fine. No problem. Not going to worry about it. So it's been actually kind of a security blanket for me.
Mm-hmm.
And that part's worked out okay. They're kind of expensive, but not too bad.
Yeah.
Yeah.
Going along that, when you were having the urge to go pee and you couldn't, or urinate, and you couldn't make it in time, was that a result of the surgery, or is that just a result of the prostate cancer in general? I mean, was that going to happen anyway?
Well,
surgery or no surgery?
he mentioned that what'll happen is that when I have to go, it's not going to be a thing where I can wait to go. It's going to be a thing where when it's ready to go, it's going to just go. It's going to release.
Yeah.
And that's what the issue is. And I will say that before the surgery, I had some issues with some leakage at times, but nothing like this.
Yeah.
This is like a whole different matter.
How many different kinds of medications are you taking now?
I'm taking Zytiga, prednisone, and I'm on Lupron shots.
Yeah. So basically 3 is what you're saying. Uh-huh.
Yeah.
And have there been side effects? Any kind of side effect? Discomfort? Anything like that?
Well, for me, the Lupron shots were horrific. I mean, I would come home after the shot, and in the middle of the night, I'd get severe chills. Next morning, I couldn't walk.
Gosh.
I was bedridden, and my wife would have to, bring things to me and help me sit up in bed and all that. And a couple days later, I was fine.
Yeah. How often are you seeing a doctor? Is it a once a week thing?
It was once a month. Now it's every 3 months. And I was being tested every couple of weeks, my blood work, my labs, because that has to be done to check that all my liver and kidneys and all that are working just fine with these meds, because they're tough. They're tough on the liver and they're tough on the kidneys. But all my labs are good. And now, because I'm really stable with all that, I don't have to have labs except every 3 months.
Great. Can we go back to the mental part of it again?
Yeah.
So when you're trying to sleep at nighttime, and I know you get the urge to get up and have to go urinate, but while you're getting ready to go to sleep, does your mind flash on this whole thing, and does it dwell on it at all?
Not at all. No, because I know what's going on now. I know what's going on. Interestingly enough, before I actually went to the doctor, I didn't want to deal with this. And so I had this little book in my bathroom, and every time I'd get up and pee, I would track it. I'd write the time and the day, and I would do that every single day. So over a couple-year period, it started out with not having to get up at all, to maybe once, maybe twice, and then maybe 3 times. And then now, it's like every hour. It's 8 times a night.
Boy.
Yeah.
Now let's roll back to the very beginning.
Sure.
For a moment. You never had any real symptoms? Nothing ever gave you you know what I mean? There was never any kind of, I better go get checked or something. In other words, had you never gone to get a physical or get your PSA checked, you would have never known about any of this, correct?
Yeah, and here's an interesting point. When I went in for this health check first to deal with this hydrocele I told you about,
Mm-hmm.
I asked the doctor, I said, well, do you guys do PSA tests? No, we don't do those, because I was like older than 70.
Right.
And he goes, well, why do you mention that? I said, well, because I have high PSA. It was like 9.5 a while ago. Before that, it was like 5 and all that. He goes, oh, well, we better do one. So they did it, and that's where it was 20.6. And the only symptoms was the urinary symptoms, where it took a long time to pee,
Mm-hmm.
and kind of start and stop, dribbling, that kind of thing.
Yeah.
And so I had a premonition, like, oh God, if I have to go to the doctor for anything, and this comes out with PSA, I'm going to be like, okay, here we go. And sure as heck, that's what it was.
Yeah.
It was high PSA, and it just launched a whole cascade of events. In fact, my urologist said, he'd look at the sheet of paper with my PSA. He goes, God, who's your urologist? I said, well, you're looking at him, because I was playing urologist, getting my own tests and everything. And I said, so what if I don't do anything about all this? He goes, you know what? I'll do everything I can to change your mind on that. In fact, I would even get your wife in here, is what he said.
Yeah.
So that's how serious it was. So I went from like, la-di-da, I don't want to deal with prostate cancer, I'm not going to go get PSA checks, to, hey, good job, stage 4, you probably have 3 years to live.
Boy.
Yeah.
And next you're beginning radiation. That's going to start in January, correct?
Right.
And it's what, 5 days a week?
5 days a week.
For how long?
6 weeks.
Boy.
Yeah.
30 visits.
Right.
How long will each visit be? Did they tell you?
Well, there's a certain amount of time that they have to position you properly on the table. They put marks on you like tattoos. And then every time you go, they have to position you for a little bit. And that maybe takes 15 minutes. And then the actual treatment is about 15 minutes.
Yeah.
And then you leave.
And this is where they're going to mark you all up, right? Don't they put
I think the planning session, which is the first one, is where they do all that.
Yeah.
Yeah.
Gosh.
Yeah, it's involved. And the side effects are everything from, blood in the stool to painful rectal area.
Yeah.
To irritation of the urinary tract, because all that's close to the prostate. And they're going to do a kind of a wide spread, because you've got my lymph nodes in the pelvis,
Yeah.
and then up higher the peritoneal lymph nodes. So they're going to be doing some stuff with that too.
Yeah. Well, I'll tell you what, if mental attitude and positive energy have anything to do with it, you're running the right course right now.
Oh, great. Thanks. I appreciate that.
I mean, the times we get together, you're always up, you're not doom and gloom, and
yeah,
very open and honest about everything, and
well, you know what?
you're taking it head on now.
Yeah, I'm not going to pee away, no pun intended,
Right.
my life being
Yeah.
miserable, because, I've learned that everything that happens in your life is all from the head outward. You can create a dream world or a horrible nightmare in your head. And I saw that first thing.
Yeah.
When I was in that waiting room. I go, well, what do you want to do?
Yeah.
What do you want to do? I said, you know what? I want to deal with this, and I want to have a happy life. And when it gets really bad, if it gets really bad, and it may not, who knows, but I'll deal with whatever I have to deal with then, and that's fine. But I encourage men, in retrospect, go get your PSA checked on a regular basis.
Yeah, I was just going to ask you, what advice can you give to men?
And do what the urologist says. And do what they tell you to do, because ultimately you're buying into a whole lot of hurt if you wait too long. Because if you go early and it's a small little area of your prostate and they do surgery and they take it out, chances are that's it. You may lose your erectile function, you may be incontinent, but you won't have prostate cancer that's spreading like I have. Now it's like, okay, they got to deal with all this. I'm taking drugs that I wouldn't normally have to take. I'm going to go through all this radiation stuff. The only thing I'm happy about is I didn't have to have the surgery. I kind of got away with that. But, and he told me he said, so I said, 3 years or less. Oh my God. He goes, well, I don't want you to worry. I don't want you to focus too much on that, because sometimes everybody's different. There's new medications that come out all the time. There's new medications. Yeah. In fact, they have a new one coming out that's it's called a PSMA lutea. I can't pronounce it. Lutea 103 or something. But what it does, it targets the PSMA on the prostate cancer cells, because prostate cancer cells have that. So it targets that, and it's like goes after each cancer cell without messing around with the other ones. But here's the thing: you have to go through all the other treatments before they let you do that.
Right.
Yeah. So
always jumping through some hoops.
Yeah.
Chuck, Thank you for taking the time today to share the journey of the whole prostate cancer thing.
You bet, Mark. Glad to be a part of all this.
Well, there you have it, folks. My best friend Chuck's journey with prostate cancer. I'm hoping if there's one takeaway from this interview, it's that men should get a regular PSA checkup at least once a year. Remember, the life you save may be your own. And that wraps up another Mark at the Mic Goes Rogue podcast. Thanks, everyone.